Cholera, a waterborne deadly disease with infections usually causing severe watery diarrhea and dehydration, and can kill within hours if left untreated, resurfaced with alarming intensity across the country, killing hundreds of lives. The cholera outbreak has affected 14 African countries, 5 of which are currently categorized as being acute crisis. Since the beginning of the year 2024, the number of cholera cases and deaths reported to the World Health Organization Regional Office for Africa, AFRO, as of 30th April was 82,215 and 1,507 deaths respectively, with a case fatality ratio of 1.8%. In recent years, the country has seen spikes in cases affecting both urban and rural communities. In Nigeria, cholera outbreaks often increase during the rainy season, which lasts from April to October annually. The heavy rainfall and subsequent flooding create conditions that are ripe for the spread of Vibrio cholerae, the bacterium responsible for cholera. Lack of proper sewage systems and safe water sources increase the vulnerability of communities. Due to the recent outbreak of the epidemic across some parts of the country, reports from the Nigeria Center for Disease Control and Prevention says it registered 103 deaths and 3,623 suspected cases across 33 states and 187 local government areas, with a case fatality rate of 2.8% since the beginning of the year, as reported by the Director General of NCDC, Jide Idris. Now, water is usually contaminated by the feces of infected individuals, and this contamination can occur at the source, during transportation, or during storage at home. However, food may be contaminated by soiled hands either during preparation or while eating. It is advisable that anyone experiencing sudden watery diarrhea should not self-medicate but visit a healthcare facility immediately. Healthcare workers are, however, advised to always practice standard safety precaution, for example, wearing of gloves while handling patients or providing care to any ill patient. Cholera is primarily caused by poor hygiene, highlighting the significant work that state health authorities must undertake to prevent deaths from this preventable disease. To mitigate cholera outbreaks, it is essential to implement a multi-sectoral response anchored on the One Health approach. This involves ensuring continuous health education, fostering community engagement, and providing safe water sources. By addressing these factors comprehensively, it will be possible to significantly reduce the incidence of cholera and safeguard the health of communities.